Hello, good morning, good afternoon, wherever you're at. Welcome to another Friday's Coaches Collab. Welcome, everyone. We're happy to have you here today. I am certified holistic pet health coach, Melissa Natanson, and today I am delighted to be joined by my colleague and PharmD, Audrey Moynihan. Hi, Audrey.
How are you?
I am super. Another day of being a holistic pet health coach and also a dog and cat wrangler today. I caught Darla, my Yorkie, on top of the cat tree again.
Oh,
How does she get up there? I don't
know.
know. Do your dogs ever, your little crew ever just get in like the biggest pickle and you're like, really?
No.
Okay.
No, besides, underneath sofas and I can't get them out, but I know they could get out if they wanted to. So,
yeah. I don't know why. If there's some Yorkie mamas out there that catch their Yorkies,
she's got some pretty good legs if she can, jump up there, though.
I tell everyone, I think she was a mountain goat in a previous life. I don't know how she gets up there, but she's highly food motivated, like most doggies, and she thinks she's starving all the time. And I know I feed her enough. But we feed the kitty cats on top of the cat tree, and most of the time I move it before she can get to it, and it was my own fault this morning. So
anyway. If that's the reason, then I would have to say my boy, my eldest, who is more food motivated and he's got a better nose than anyone I know, he'd probably try to, but he's got luxating patella. He probably wouldn't get far, but he would attempt.
That's little Carter?
Little Carter. My boy.
Well, enough about the craziness at my household. We want to talk about you. When I joined the holistic health program, Delora DeVore, who just popped on. Hi, Delora. The program director. She told me, she goes, you know what? I still can't believe how many brilliant minds we have in this program. And it's true. And you, my dear, are one of them. You are a PharmD. You have a doctorate. And so we like to say from prescriptions to Paws.
I love it.
I love it too. I want to hear your story, Audrey, of what inspired this shift. I want to hear it from your mouth.
Well, thank you for having me. And so, like you said, I am a pharmacist by training. I decided very young that I wanted to be a pharmacist, I guess like 6th grade, because my mother was always sick. And so I wanted to do something where I could make my mom well. So I decided very early I'm going to be a pharmacist. I followed that in high school. I took every math and science class you could take. As soon as I was old enough, I was looking in pharmacy colleges. What did I need to get in them? Did all that, went to pharmacy school, and became a pharmacist. And I love pharmacy. I love wellness. I love helping people on their wellness journey. But I also love animals. So it's funny, when I graduated from college, I'm like, I think I want to be a cat behaviorist. I was a cat lady at the time, 4 cats. And then I was thinking, well, let's see, I know nothing about that. And that's not going to pay my student loans. So I did get a job in pharmacy, and that worked out very well for me. But again, I love the journey. I love pharmacy. I love helping people. I actually worked retail behind the counter for over 16 years. And then I got a corporate job so I could have normal hours, like normal people. Retail hours are hard. If anyone does retail, it's hard. So I did that.
I share that experience with you.
Right. Oh yeah. You guys have a store. It's hard. Retail. It's hard.
It's exhausting. Any of you have been in retail? Our hearts go out to you. It's not for the faint of heart.
Yeah, I was going into a second marriage, and I was working 3 nights a week and every other weekend. And I'm like, yeah, that's not going to work. And so, like I said, I got a corporate pharmacist job, and it paid off very well for me in the end. I was there for 21 years. That went really, really well. But throughout my career, again, I always had this tugging in my heart that I have to do something with animals. I was made to do something with animals. What am I supposed to do? I was made to do something like that. That's always in your heart. And so that's always been there. And then I had this aha moment during my career where I started to realize that drugs cause a lot of side effects. And, not that that should be surprising. That's what I learned in my 6 years of schooling. But it starts to catch up on you when you start seeing it and you're seeing the additive effects and you see long-term side effects, right? People are like, oh, it's not me. But they kind of get worse and worse when you're taking them long-term. And I started seeing that.
Yes.
And then people take drugs to counteract the side effect. And then they get drug interactions and other side effects. And then it gets to the point where
and then you have to take a drug to counteract that side effect.
And then you don't really know, are your symptoms your illness or are your symptoms the drugs? And so a big aha moment came for us. A friend of ours, mother-in-law, went into hospice care. And when you go into hospice, they stop all your meds and they just leave you on pain and anxiety meds. And she actually got well, got out of hospice and lived another 3 years. So I always say, are people on a lot of drugs because they're really sick, or are people really sick because they're on a lot of drugs? You know, the healthiest people that I know that are older, my mother included, she's not on any drugs, right? You know, the less drugs you're on, it seems like the healthier you are. So which came first, the chicken or the egg? I also, like I said, I look at long-term side effects. There are certain drugs that, you know, they were not made to be taken long-term. And there are people that have been on them their whole life. And you can read in the package insert, don't take more than 30 days. And they have a lot of really, really bad long-term side effects: Alzheimer's, cardiac, liver or kidney failure, cancer. And so that was kind of a point for me, like, you know, that's a little uncomfortable. That's, you know, I know drugs are important. I know we have to treat disease, but again, what's better or worse, the side effect, the drug, the illness?
Well,
how do you weigh that?
Right. And I feel like we're kind of diving in the deep end early on here, and that's okay. But excuse me, I feel like this is part of how we got here today.
Right.
I share part of Audrey's sentiment. I share part of your sentiment, Audrey, having had really, I guess, terrifying, to say the least, and awful experiences with lots of medications, both for myself and my family 10 to 12 years ago. And like you, I just kept thinking, there's got to be a better way. There's got to be a better way. And that's really when my eyes started opening to holistic care. And it dawned on me that so many of our ailments and so many of the ailments of our pets are not from a medication deficiency.
Exactly.
We, as holistic pet health coaches, look at the body as a whole, and we're supporting mind, body, and spirit. And vets who do have the capability to treat, we love them, we need them, but they're also seemingly more often than not pigeonholed into what they have learned, which is the world of pharmaceuticals. And you know that better than anybody.
Right. Yeah, I agree with you on that one. For me, my holistic journey started, it was about 10 years ago. And I learned about essential oils. I don't think I mentioned I'm a certified clinical aromatherapist and certified animal aromatherapist. And about 10 years ago, I started learning about essential oils and their therapeutic properties. And I was like, well, this is fascinating. They didn't teach us this in pharmacy school. So I started doing a lot more research and trainings and classes. And that's when I got some of my certifications. And I took that, and then this whole side effect with drugs, etc. And I decided at that point in time that my family was going to start doing more holistic. We're not going to take drugs anymore. We're going to use essential oils. I mean, are there places where we have to use drugs? Yes. But we don't pop a pill for every ache, pain, and sniffle, because we don't need to. We use essential oils. So that kind of started my holistic journey, and it was almost, you know, on the natural side of allopathic, it would be like, oh, here's an illness, here's an oil, just like you would use a drug, right? So that's kind of how I started was, oh, I've got this, instead of taking ibuprofen, I'll use an oil instead.
And that's go ahead.
No, I was gonna say, that's kind of what started my holistic journey, was that.
Right. Well, and that's kind of your superpower too, Audrey. You know, we always talk about a lot how we have so many, once again, brilliant minds in this group, and all of us really have certain specialties and have honed in on knowledge. And you are definitely the one a lot of us go to when we've got questions about essential oils. And the same with our listeners today, pet health enthusiasts, pet parents out there. If you've got questions for Audrey when it comes to essential oils, she has got quite the background on it. And so thank you for telling your own certification. I wanted to mention it to you, but you beat me to it since we were already going down the pharmaceutical rabbit hole. But I want to hear a little bit more about some of your success stories when it came to the aromatherapy and the essential oils that really kind of solidified you going down that vein.
Yeah, I have a great story actually just from this week with essential oils. I have a family I've been working with a couple months, and it was a little kitty that was thrown out of a car and had dead tail. So damage to the spine and that. And the doctor told them that if feeling is going to come back in those vertebrae and in that area, it would take about a month, but after that, whatever, they've got, that's probably all they're going to have. This family was actually manually helping, the kitty to poop and peep, right? Because the kitty didn't have any feelings. So they did that daily, express the kitty. And so I suggested some essential oils. They actually came to me with the kid. I was working with them on a different cat and one of their dogs, but they came to me with this kitty because as they expressed the one time, there was a bunch of blood in the urine. I'm like, what are we supposed to do? What are we supposed to do? And they were going to the vet and, they thought it was a UTI. So I gave them oil suggestions for that. And they started using the oils. Within one day, the blood was out of the urine. So that was kind of a yay.
Wow.
And he was able to use oils to help support the infection. But then, that's when I started working more with them on this dead tail. And I said, here's some oils to help with nerve damage, things like that. And PEMF, I love PEMF, pulsed electromagnetic field, the pet's PEMF pad. They had one of those. And they've been using the oils and PEMF. And they went to the doctor this past Monday and they sent me a video, and she was talking about how much better he's doing. And he's got feeling, a couple more vertebrae down, which is a miracle. And she goes, I didn't expect any more than what she got back in February because it had already been a month. And he's already got more feeling back, and he's peeing and pooing, or it's a little girl. She's being able to go peep and poop on her own. So, and that was using some oils that support nerves. And so, that's been a great success story for them and for this sweet little kitty. I use essential oils, obviously, with all of my pets. My little guy, my heart dog Carter, has a history of mast cell tumors. And he had one in 2020, and they had to remove his tail. We got clean margins, and so that was good. And then he had another one exactly 3 years later in 2023 in his chest, removed it, but did not get clean margins that time. So it's been it's that.
It's a struggle.
How do we keep cancer cells out of his body, right? That's all I can think about. No cancer cells. So changed his diet, all that. And I do rub essential oils. We call it the Kill It blend on the area, where it was taken out. We do that every single day. Been doing it for a year and a half now, because it was January 2023. I went to an oncologist in April because we thought that we had a flare, and he did an ultrasound. There was no metastasis to liver or spleen. There was no sign of anything. And
thank goodness.
he actually said, if I saw you a year ago, I would have put him on chemo.
Oh my.
Because they didn't get clean margins. And I was thinking, then he'd probably be dead now.
Oh,
and he said, whatever you're doing, keep doing it. Like, he was really surprised at how well he was doing.
Oh, little Carter.
Yeah. And so, and he does his PEMF pad and he does light therapy. But I think a lot of it, this is, so I'm going to kind of go back to my story again really quickly.
Right. We sidetracked. That's
I'm
okay.
all over. I retired from my pharmacy career in October. And I was like, I want to do more holistic pet stuff. I don't really know what that is, but I know that I'm an aromatherapist. What more can I do with pets? And I typed in holistic pet, and I found Dr. Ruth's program, like right after I retired. And I was like, this is kind of weird. So I did more research into it. And I was like, this is it. At the very same time, but that same weekend, I just retired and all that. I read about Bobby, the oldest living dog, who was 31 and a half years old. And I'm like,
Isn't that amazing?
yeah, like
It's
that.
just,
He's my inspiration.
right?
Bobby, my inspiration.
I know.
And I said, I want all my dogs to live till they're 30. And
We
so
all do.
I decided to take Dr. Ruth's course, which I have to say, absolutely fabulous. If anyone is like wondering if they should do it, it was so good. And I've taken a lot of certifications, a lot, aromatherapy and other things. I love the course. I love the format because it's videos and it's written. So like people learn in different ways. And
That's
so
right.
some people need to hear it. Some people need to see it. I love that about it. I love the homework because it's not just head knowledge. I'm a head knowledge person. Like school was very easy for me. Reading, oh yeah, I could take a test and do really, really well on it. But it was
It's applied knowledge.
you
We
have
have
to
to
do
apply it.
yeah,
Yes,
every single week, the homework, you have to do something with it.
that's right.
You can't just read it.
No,
You've
this
got to
is
read it
not, this
and
is
apply.
fairly hands-on.
Yes. Yeah. And I love that because it forced me to actually do something with what I learned every week. So I love that. I thought that the content was better than other programs I have taken.
And yeah, oh, I'm sorry. I didn't mean to
Nope.
interrupt. I just think it's amazing and yet another testament to Dr. Ruth and the brilliant program and this movement that we started. Here you are with a doctorate and you're like, hey, this program is amazing. And I
Mhm.
have to second what Audrey says because I think this program has been life-changing for so many. And our mission now is to continue to help to change lives because of our knowledge, our background. We're all coming to it with different reasons why, but at the heart of it, we have a passion to turn our love for pets into a way that we can help them and help pet parents, number one, because we are in an epidemic
Yes.
of pet health problems, from cancer to allergies to skin issues, from IBD to gut to kidney. It's weekly we see these things, and it's disheartening when we have 1 in 4 dogs getting diagnosed with cancer. It's 2 in 4 out of if they're over 10 years old.
Right.
It's heartbreaking, and I feel like it makes us all take a big step back and think, what's going on here? What is at the foundation of this? And one of the biggest things that we learned, and I've studied dog nutrition for several years, is the nutritional aspect of it. And what is that, Audrey?
Whole foods, not brown. What do you call them? Brown.
I call them burnt brown balls.
Burnt brown balls.
BBB. No BBB.
And so, I'll go back to my Carter story. I take Dr. Ruth's class and I start learning more about, I kind of know about nutrition, but not that much. I was feeding them raw, that's good. But I took Dr. Ruth's course and I learned so much more about how to apply a lot of this to my Carter. Right. And how do I apply? I got a little boy who possibly has cancer cells inside his body. I am not okay with that. And so how do I apply nutrition, the supplements we learn about? By the way, Carter, my little hard boy, he's 15, so he's not a youngster. And I really learned so much in Dr. Ruth's program of what can I do to continue to help support him. So when an oncologist says to me, keep doing what you're doing, that's a testament to what we learn and what we're doing to help these animals.
Absolutely.
I thought that was a big, big deal. Yeah.
Well, and our colleague, Melissa Sherman, just posted something that I want to tie in with who we are and what we do. And she was saying, visualizing the perfect cell for Carter. This is what I like to think about a lot of times when we think about food as the basis of the foundation of health. Let's just say that. So we're thinking about the cells, how our cells are operating, how they turn over, how they renew, how they multiply, or how they duplicate. And at the core of it, organs are just really a big clump of cells that have become an organ, for lack of a better word, that has a certain function. But at the core of it, if we're not firing up and powering those cells with good energy, then how can we expect the organs to operate? So taking a step back and we think about food as the foundation of health, we have to give our pets good energy that fires up their cells and makes them vital and thriving, because that's how they get good energy. If we're giving them burnt brown balls, it's dead.
Yes.
And it's depleted. It's inflammatory. And it's not in a format that our little pets can digest and assimilate in a way that's going to create good energy so that they can thrive. And Carter's a testimony to that, that as he's getting the things that he needs, here he is, even in the midst of having some mast cell tumors. And I want you to talk a little bit about what that is. He's still thriving. I like to tell the story about my little Darla. She's 14, Yorkie. She struggled with IBD and intestinal issues and things her whole life. She had a really super tough rescue. She was found on the streets eating trash. She was almost a goner. And as soon as they said there's nothing she can eat. She's allergic to everything. So I started making her food at home. They told me she wasn't going to make it past 8. She's now 14.
Wow.
And she still runs around and climbs cat trees like a little baby Yorkie should.
Does she get all excited when you feed her? Like mine gets so excited when I feed them. Like they run around and start yipping just to eat.
Right. I mean, everyone's like, is your Yorkie picky? I'm like, are you kidding me? She would eat a dead horse if I put it in front of her. Like it is her favorite time of day, unless she's not feeling good. And then she knows. So anyways, but I'm still like kind of chuckling about how you were almost a crazy cat lady.
Yeah.
We love crazy cat ladies, by the way.
I was a crazy cat lady. Yeah. I had 4 of them. And I always say, and my husband still married me. So that's a testament to him. And we no longer have cats because we travel a lot and we could travel with our dogs. We travel in a motorhome. But when people ask us what type of dogs we have, my husband always says, oh, they're cats that bark. They're chihuahuas, so in his eyes, we still have cats. They're just, they bark. So
they're just coming in a different form.
Yes. I love.
So now you have 3 little pet kiddos.
3 chihuahuas.
3 chihuahuas, and we have Jonah, Carter, and
Ruby. Yeah, my sweet little girl. She's like real sweet, and she doesn't get a lot of spotlight because she's quiet and sweet, and the obnoxious ones tend to get more spotlight. But yeah, they all have their stuff going on. Jonah, he'll be 7, and he's a fire dog, like a fire dog. Anxious, gets upset with storms, so we're working a lot with diet and him and herbs, tapping. Thank you, Melissa Sherman, for helping me with EFT, and trying to, take some of that out. And he's not perfect, but he's getting better. When we've had a lot of storms in Chicagoland the last couple of weeks. Wow. He's better at self-soothing. He'll jump off the bed and go hide in the closet. Whereas before he would just stay in the bed and shake and pant like for hours. And I'm like, he's going to have a heart attack, And so he's doing a lot better. So yeah, again, still learning everything from the class and what do we need to do to, kind of put that fire out and, use CBD and just so many different things that we learn in the class that can help us to make our pets well.
Right.
And it doesn't have to be drugs, right? I don't have to put them on Prozac or whatever, the things that they're using these days, trazodone, because again, that's not my goal. I mean, if he needs it, again, I always want to tell people, I'm not totally anti-drugs. I'm a pharmacist, right? I believe there's a place for drugs. I don't believe we start with drugs.
Right.
I believe we start with more holistic, natural type of options. And then, if we need, when Carter on Easter, Carter had a lump show up on his chest, which is where his other one was removed last year. And I gave him a Benadryl immediately, right? There is a place. He got that. He got lavender, which has antihistamine properties. I mean, he did everything because mast cell tumors, they are
superhistamine producers.
Cancerous tumors that are histamine producers. And so we had a histamine release, a histamine reaction, and his whole belly turned black and blue from from the degranulation. And so, we did our oils on his tummy every day. And that's when we ended up going to the oncologist to see what was going on. And he goes, I think he got bit by something. So I'm like, okay. Or, spontaneous healing. I still believe in miracles. So so that was really good.
All right, Miss Audrey, we have some questions coming in for you. Mm-hmm. So let's see. So Jen says, Audrey, how did your pharma colleagues respond to your holistic approach? And how do you get them to listen to a different paradigm? What a great question, Jen.
Pharma colleagues are a little, they're more skeptical, right? They think, I'm a little crazy, which that's okay. That doesn't offend me. People think I'm crazy. But I think that people, especially my pharma colleagues, should know that I have training, like the same training as them. And I know how drugs and that work in the system. And if I believe in essential oils, I must have done some research to believe that. One of my fun stories, a girlfriend of mine, a pharmacist that I worked with, I'd tell her about oils all the time. And, oh, yeah, that's nice, Audrey. And then there was a day, it was a Saturday, and she calls me on the phone. Audrey, my daughter's on her 4th round of antibiotics for an ear infection. And we all know antibiotics, they're bad. They kill your gut microbiome. They say it can take up to a year for your body to recover from one course of antibiotics for your gut to come back to what it should be. She's like, my baby's been on 4 courses of antibiotic in a month. I can't keep doing this to her. I need to try the oils. Right. And I said, okay. I said, meet me. It was a Saturday. I said, meet me at work. And I brought her some oils, and she started using them topically, behind the ear. And within 24 hours, her baby was better, and she became a believer, and wow. She started telling people, you have to believe what Audrey says. So, I think some people get it, and other people, and I think it's our world, right, where people believe that drugs heal everything, but sooner or later, people have to get to a point where they see there's a benefit and a risk, right? Yeah, drugs can do this, but what does it lead to?
Right.
What's the long-term effect? And are there other things we can do that doesn't have that effect?
Right.
So,
when we're supporting the cells, when we're supporting the good energy.
Right.
So maybe let's go into that just a bit more. Can you explain a little more how the essential oils work? Because
So if you look at so essential oils, each oil has a lot of chemical components in them, alpha pinene, beta caryophyllene, all these different chemical components in each oil. And what you see in pharmaceuticals is they will take plant. I mean, if you think about it, pharmaceuticals are all pretty much plant-based, right? And they take a substance out of a plant, and they isolate one component of it, right? Okay, here's this one component, and it might lower the blood pressure. And then they take that, and then they create it in a synthetic form. Well, when you create something in a synthetic form, essential oils look like our bodies. They're carbons, they're oxygens, just like our bodies are. When you create a synthetics don't look like our body. And so that's when we start getting side effects. Also, when you isolate something out, I'll use an example of CBD. If you use CBD, if you use full spectrum, which has a little bit of THC in it, okay, not a lot, there are protective properties of the different components of CBD, the THC, the CBG, they all have all these different properties. And some of those properties are helping to prevent side effects possibly from another component of CBD. When you isolate it, then yeah, we love CBD dog health. When we isolate CBD and it's a CBD isolate, then we don't have the other components that might be having a protective effect. So some of those components might be protecting the liver, things like that. That is what happens with medications. We isolate a component, and that component can cause side effects. Whereas if we hadn't isolated it and we use the full plant material, there are other components in that plant that help synergize and help to balance the component itself. And that is why essential oils, they work similar to drugs, right? Because it's what drugs are made of. But because we have all the components in place, like a full plant would, then we have benefits of the other components of the oil. So it has similar therapeutic properties, but it also has balancing properties that help balance some of the effects of the oil itself.
That was a fantastic answer. Thank you for clarifying. I feel pretty confident in essential oils, but that clarified a lot for me even, and was very, very helpful. A lot of you know that if you've been on the Coaches Collab before, kidneys and gut health and the microbiome, that's my wheelhouse. Audrey's is definitely essential oils. Yeah. And we've got a couple more questions coming in, but before we get to those, that was another thing that we like to talk about on here is we have got all of us, we're a team. And how amazing that we've got you on our team as an essential oil expert and a former pharmacist. There's so many different talents on here. And when you are working with a holistic pet health coach, when you are working with someone on Dr. Ruth's team, not only do you have them, but you have a team of brilliant minds like Audrey in their circle and on their side. And in addition to, we have Dr. Ruth too. Right. So we're not afraid of the tough cases. We're not afraid of the tough ones. If you have struggled with your pet's health and you thought, I don't know what to do next, reach out to one of us because we've got a team behind us. And if we don't know, we're going to ask someone that does. And we're here to guide and support in making the best decisions that you can for your little pet baby where they are, so that we can help set that foundation for healing. And with Audrey, one of those would be to incorporate essential oils, which I think is amazing. But going back to those essential oils, Rena and Jen both had a similar question, which is, we know that not all oils are created equal and not all oils are safe. Can you talk a little bit about more brands you use and trust, and what oils are not okay for our pets?
Yeah, I was going to say that when we were talking about it, I'm like, I won't bring it up now because, so if we look at essential oils on the market today, about 80% of essential oils on the market today are adulterated. So
what does that mean? What does that mean for?
So an adulterated oil, it can mean a lot of different things, but it could mean they add in fillers that are synthetic. Some of them have oils in it that are not the real oil. They did a test of I think it was a peppermint at Walmart. There was no peppermint oil in it. It was corn mint oil, which is a lot cheaper, but it smells like peppermint.
Oh, goodness.
And so they cut it with other oils that smell similar, or they cut it with carrier oils, etc., to dilute it. Because if you're looking at it, most places that sell essential oils, their goal is to make money. Right. Their goal is not promoting therapeutic use of essential oils. And so the oils on the market, you see most of the oils on the market, brokers go to these underdeveloped countries to buy oils from these farmers. They do not pay fair trade wages. And then these brokers sell them to whomever, who sells them to someone who's going to distribute, etc. The further you get away from the farmer, the more adulterated it can be, because every time it changes hands, what are they doing? They're trying to make money, right? Oh, let's add a little bit of this in, and then I can make more money on it. So oils, a lot of adulteration in oils. We don't want to use adulterated oils because we don't know what's in them. And the FDA does not regulate it because it's a supplement. So it could say 100% pure natural on the bottle, and that does not mean a thing.
Whoa.
That could mean that one drop in the bottle is pure. So
wow.
I always say, don't buy essential oils in store. If you're buying them in a store, I could pretty much guarantee they're adulterated because again, the processes they went through just to get them in that bottle, they changed too many hands. And if you're changing that many hands, you don't know what is in it. So I like oils that come directly from the farmer, from small batches. I'm not going to speak to which oils I use. If you'd like to reach out to me, privately to do that, I can tell you what oils I use. And I do sell essential oils. And I can tell you about that. I just don't want to put it out here. But again, my goal is to get oils that come from the farmer. We know where they came from. And we want every single oil we have to have a GCMS report, which is gas chromatography, mass spectrometry, which means the oils have been tested.
There's go ahead.
No, go on.
I was going to say there is a link to Audrey's essential oil website in the comments. So if anybody's got further questions or wants to pick Audrey's brain a little bit more about what the safe oils are, because that's huge and it is a great question. I know that as pet health coaches, we've got clients that will come to us and say, oh, well, I'm using this and this and this. And it's helpful to have a guideline, not only for them, but for us too, to be like, hey, let's not use tea tree. That one I know for sure.
Tea tree.
Yeah.
Let's birch, wintergreen, tea tree. It's interesting. I was working with a client for her kitty and I suggested some oils and she used them topically on her cat. I didn't tell her to use them topically, but she did. And the cat had a seizure. And then she came back to me. Well, it turned out she was using store-bought. And I was very clear. Don't use store-bought. I don't know what's in that. Or you don't know what's in that. Why would I use something if I don't even know what's in the bottle on my pet? So it is really important to know the purity of your oils and where they come from. Because again, I'm not using things on my pets that I don't know where it comes from.
Right. We're going to do one last question and then we're going to move on to my favorite part. Well, I mean, you've been my whole favorite part. Like this has just been
so funny.
No, this has been so great. This is so much wonderful information. So real quick, Jen asked, she has a fire dog. She says, quick rapid fire, what oils would you recommend for that?
Fire dogs, we think of calming oils. So lavender. Oh, yes, you put lavender. CBD. I like clary cedarwood. I love cedarwood because I love the smell of cedarwood. I put it on every night at bedtime.
I love
cedarwood, clary sage. I use ylang ylang sometimes. Pettigrain, which I think, and neroli. Rose is a very nice oil of trust, it's called. So that is very, very nice to use with rescue dogs for trust. And then wild orange. Wild orange is a pick-me-up and a calmer. So I'll usually throw like lavender and wild orange and cedarwood in the diffuser if I leave my dogs alone in the motorhome, just to keep them calm.
That's interesting. I'm so attracted to, I must be fire, because I'm so attracted to rose, always have been. And I used to get teased all the time because you're like a grandma. You always smell like roses. I'm like, what? No, that's not true. But I mean, I have rose everything, and I'll douse myself in rose water, and
I love rose water.
I love rose water, and
if anyone works with dogs.
Animals.
If anyone works with dogs, or pets, and you're doing a one-on-one, I always say spray yourself with rose hydrosol before you go and meet the animal, because that scent is going to make them trust you more.
Yes. And it's also very clearing on a emotional, spiritual, energetic level. Rose is very clean. It's very high energy. It's very grounding, and it's very clearing.
Yeah.
This is fantastic. So my final question for you, Audrey, from me is, if there was anything that you wanted people to know about you and why you're doing this, or maybe if there's something you think that anybody misunderstands about why you're doing what you're doing, what would it be? This is your chance to show us your heart.
I think the biggest thing is, I see people as I age, and people are on these medications, and it is impacting them, and it's impacting their life. A very close friend of mine in South Carolina, very, very healthy. And then she went on a lot of meds, and, she went downhill relatively quickly. And I don't think drugs are the answer to everything. And I think that oftentimes people get sicker when they start taking a lot of meds. And I want people to know that we can do other things that are natural. We should be starting with diet. We can do supplements. There are so many other things that we can do before we start adding more and more and more drugs on. Because again, they're causing side effects, and you start blurring the line of what's a side effect and what's your illness. And that's just not a good place to be. So my heart is really helping people to try to find ways to manage their wellness and their conditions in a natural way where you have less side effects. And again, I'm not saying there's no place for drugs, but is there a way to implement things where you can start reducing the dose or taking it every other day? Because if so, that can mean a lot to your health. And I think that's one of the biggest things for me, is helping people to see. I think some people think being on a lot of drugs is some type of prize or something. Look at all the drugs I'm on. And they identify with that. That's who they are. And I want people to know that, let's identify with healthy things. Like, look at how well I'm eating and the supplements I take to make me well, rather than being on a lot of meds.
Bravo. Amen to that.
Carter has, so I've already told you, he's got history of mast cell. He's got liver problems. He's got kidney problems. He has a heart murmur. He has luxating patella. He's got enlarged liver. And he's only on one prescription medication, which is ursodiol for gallbladder sludge, So to me, we're going to manage it in other ways. It's not going to be adding a drug and adding another drug and adding another drug, because in the long run, what do we get from that?
Well, and so often what we do, if there is the need, once again, if there is the need, sometimes there is a need. If your dog has congestive heart failure, it needs to, more often than not, be on a heart medication. But there's things we can do to come in and support and support that heart muscle, so that the dog's or kitty's quality of life and happiness and overall health is increased.
Exactly.
And it's managed, rather than it being, your doggy may only be here for 3 months. Lots of them can go for years after that with the right kind of support.
Agreed. It's like amazing, and I don't think anyone who's been listening to any of the Dr. Ruth's coaches calls have heard it over and over and over again. These dogs that were so sick, and all we did was change the diet, and we have a new dog. This dog, he's not going to last more than 6 months. We changed the diet, and he's still here today. And I just think that is an amazing thing. And it's a testament to what we put into our bodies. And, I think it's people, and I think it's pets. And how do we, look at what we put in our bodies, more food than drugs to make us well. Let food be thy medicine, right?
And medicine be thy food.
Yeah. So that's my biggest.
I agree. Well, if any of this resonates with any of you listening, once again, if you are interested in becoming a holistic pet health coach, we'd love to hear from you. There are links in the comments where you can sign up for a workshop with the wonderful and amazing, the original pet health coach, Dr. Ruth. We are so glad that she is leading the charge, and we are with her all the way as part of this mission to make the lives of our pets happier and definitely healthier. So on that note, I don't have a ringtone yet, but it's coming. Pet perks and pet peeves. Where's the balloons that usually go up if I put my... Where are they?
No balloons today.
When I need the dang balloons, they don't come. I try. So, Miss Audrey Farm D, if there were 3 things that you could just wave a magic wand and be done with, wipe them off the face of the planet, that would make our animal lives better, in your opinion, what are they? What are your pet peeves?
You want to know my number one, and I never even told this to you, so you'll laugh when I say it.
I'll be surprised.
Plug-in fragrances.
That's a
Glade
great
plug-in. I
line.
mean, maybe it's because I'm an aromatherapist, right? And I realize that fake fragrance is so unhealthy, endocrine disruptor, hormonal disruptor, and people are like
Phthalates,
spraying this.
PCBs.
I had a like a Glade plug-in thing under a cabinet in my kitchen. And over time it ate a hole in the cabinet that it was right underneath. And if it's doing that to a cabinet, what is that doing to my lungs and my pet's lungs?
Good point.
Besides the fact that fake fragrances are really, really bad. So anything I'm ever on, I'm always like, get rid of fake fragrances, no Glade plugins. That is one of my number one pet peeves. There are, certain medications and drug classes that I wish would go away. Obviously, flea and tick. I think that a lot of veterinarians underestimate, how bad flea and tick is. I don't care if it's only a certain percent that have neurologic damage. If you see one video of an animal have neurologic issues from a flea and tick, you would never give it to your pet again, because that's the saddest video you'll ever see. So certain medications, flea and tick medications, like antibiotics. I mean, there are places antibiotics, but I don't want to just go to the doctor and say, well, we don't know what it is, so let's put them on antibiotics, because like that doesn't help anyone. So,
well, and I think it's antibiotics when they're unnecessary. If you have a confirmed infection and the only way to get rid of it, it is an antibiotic, well, then great. But it's handing the antibiotics out as a prophylaxis when we don't know if there is, in fact, an infection, is where we get to what you were talking about earlier, is when we destroy the microbiome. Exactly. Because it's killing all the beneficial bacteria in there, as well as any unbeneficial bacteria. So I think it's important that in both humans and pets, we need to hone in on this antibiotic stuff. Maybe I'm telling a little secret about me. I haven't had an antibiotic in 25 years. They've been offered plenty of times, but I didn't have an infection. Right. It was, I go in for a cold or something, and here's an antibiotic in case it's a respiratory infection. Well, it wasn't. So, it's helping the body heal first, but there's a time and place for everything, right? I think
that doctors have learned that when someone come to the doctor, they want to go home with something. Yes. And so doctors just give antibiotics because I think they're doing it to shut people up, because that's what someone wants.
Right.
But the person doesn't know any better. So,
right.
Yeah. And then my third would be pharma companies and big pet food companies, because I think that they're not honest to us. Yeah. Their marketing is not honest. I just think a lot of the studies are not honest, and I wouldn't mind if pharma and big pet food companies were around if they were honest and actually looking out for the best of people, rather than framing things to look really good when maybe they're not. Like, be honest, right?
Right. Well, and the moral of the story is that we have to be our own advocates, both for our own health and for that of our little, fur babies. And all it really takes is reading the ingredients on some of those that shall not be named big pet food companies. And there's 25 to 30 ingredients, most of which I can't pronounce. And I'm a smart cookie too. And if I don't know, well, I do now. But, our everyday pet parent isn't going to know that some of those things are not appropriate for our pets. And here's my little tip. If it's more than 7 or 8 ingredients, probably not a good choice. That's something I look for. Or we can make it at home. That's why, another part of being holistic pet health coaches, we've got the awesome Crock Pet diet, and you can make healthy, amazing food at home that is customized and tailored to your pet's needs.
I love it.
All right, Audrey, what are your pet perks? Can't wait. You had such good pet peeves.
Well, I mean, my obvious number one pet perk would be essential oils, right? Yeah. Because that's where I started. That's what I use. That's what I think can really help our health. So that is definitely my number one. My number two, you actually brought it up earlier, and you and I have never talked about this before, but is positive energy. Carter at one point in time, a couple of years ago, he was peeing a lot and drinking a lot. And I'm like, oh my gosh, he's sick. He's sick. He must have Cushing's. He must have kidney disease. And, if that's the energy you're telling your dog, oh my gosh, you're sick. Oh my gosh, you're sick. Oh my gosh, you're sick. You're giving that energy to them and they're going to get sick because they don't know better. Right. So to me, your energy is so important. And that little boy, when he had his surgery last year, I mean, he had an incision from here all the way down. It was just unbelievable. And I'd put light therapy on and I would rub him and I'd say, I'm so proud of you. You're so healthy. I'm so proud of you. You're so healthy. And I tell him that every day. I'm so proud of you. You're so healthy. I'm so proud of you. Because if you give them that energy, they think they're healthy, right? Because that's the energy you're giving them. And I say, and all of your little cells inside your body are happy and healthy and plump.
That's right.
Tell them that all the time. Yeah, happy, healthy, plump cells.
I love that.
And so I don't think a lot of people realize how their energy. I told Carter a couple of weeks ago, I said, Carter, I think that your health is a lot better now since mommy retired because my job was, my corporate job was very, very stressful. And I said, I think you're a lot healthier now, Carter, because mommy isn't as stressed. He probably looks at me like I'm crazy. But I think energy is bigger than most people realize. And they need to realize if someone in the house is sick, we're not going to concentrate on that. We're going to concentrate on you're getting better. You're getting healthier. I'm so proud of you. You're so strong. Your body is strong. I think that's another big thing for me. And then admittedly, supplements, I love supplements, but I like devices. So I love red light therapy, biomat. Some people might have biomats. I don't have one of those yet. I'd like one.
What's a biomat?
Biomat, it's a mat and it's an energy healing thing. And I don't know, but I want one.
Maybe I should. How do I not know what this is? I'm like looking right now. I'm like, what is this?
Yeah. A lot of massage therapists have biomats on their.
Is that more grounding?
Yes. Okay. Yeah. And it's got stones and it's just I want one of those. PETS PEMP, so pulsed electromagnetic field. I have a couple. I have a CZ loop. I have PETS PEMP. So I'm all about that. I use it on myself when I have pain. I have an injured elbow. I'm putting his PETS PEMP on my arm. So I like to use other things because there is a lot to be said for the red light and the energies and all of those type of things for healing. So admittedly, I like those type of things. Those are some of those things that I really enjoy using in my practice. And like I said, supplements to, of course, a crock pot diet because I do cook for mine. And then adding supplements based on what's going on. Carter's livers had some problems. We had supplements. And I just think there's a lot to be said for that. We can use supplements rather than, again, throwing drugs at things. So those are my biggest favorite things for my puppies.
These are great. These are great tips. This has been a wonderful live. It's been so informative. And let's end this on a positive note with some positive energy since we were talking about that. I am wholeheartedly with Audrey that, when our pets aren't feeling well, it's hard to not worry. Of course, we're going to worry. These are our kids, right? These are like our children. Mm-hmm. But we tend to take on this energy of we've got to fix them instead of kind of like Audrey's motto of happy, healthy, and plump, or may you weigh well. May every cell in your body have positive energy and good energy. So I think Audrey's with me. We're going to leave this little tip today as we end this Friday's Coaches Collab that if your pet has got some health issues, take a step back from the worry and try something different. Maybe try just sitting with them and being. I know Melissa Sherman taught us both of this. Just being, meditate with them, hold them in that positive energy, hold their cells in that positive energy, and you may be very surprised the difference that you see. Anything you want to add before we take off for today, Miss Audrey?
No, I love that. I love that. Being with them and yeah, just be a part of that. I love it.
Well, thank you again for being here today. Your information is invaluable, and it's such a joy to have you on our team. And speaking of team, ladies, you are just the best. I don't know
Best.
what I would do
Best.
without all of you. Thank
Mhm.
you to the rest of the team and our listeners who came on today. Your support and having you all has been, it's just wonderful to have you all here. I appreciate it. And know Audrey appreciates having all the support. So once again, thank you for joining. This has been a wonderful Coaches Collab. May you be well and positive vibes. See you next time.
Bye, guys.
Bye-bye.